Assalamualaikum. I am Sara. Today here is a presentation on tibia. This is the tibia of left side. Its expanded end with condyles faces upwards. Tibial tuberosity, sharp sinus anterior border faces anteriorly. Medial malleolus is on the medial side. Superior surface of the upper end lies in a horizontal plane. The tibia is the second strongest and largest bone in human body. It is a typical long bone and has three parts: upper end, lower end, and intervening shaft. In the upper end there are medial condyle, lateral condyle, intercondylar area, tibial tuberosity. In the shaft there are three borders and three surfaces: anterior border, medial border, lateral border, medial surface, lateral surface, posterior surface. And this is the lower end with medial malleolus. Now come to the attachments. The medial condyle has four surfaces: superior surface, anterior surface, posterior surface, medial surface. The superior surface is concave in the center and flattened in the periphery. The flattened peripheral parts gives attachment to the medial meniscus, and the concave circular parts articulates with the condyle of femur. The posterior surface, here is a groove for the tendon of semitendinosus. The anterior surface and medial surface gives attachment to the medial patellar retinaculum. The lateral condyle has superior surface, anterior surface, lateral surface, posterior surface. The superior surface, in the center it is concave and flattened at the periphery. The flattened peripheral part gives attachment to the lateral meniscus. The superior surface in the center articulates with the lateral condyle of femur. In the anterior surface there is a triangular area for iliotibial tract. In the posterior surface here is a facet. This is called fibular facet, which articulates with the head of fibula. In the posterior surface here is a groove for the tendon of popliteus. The anterior surface and lateral surface gives attachment to the lateral patellar retinaculum. The intercondylar area gives attachment to six structures. From before backwards, the structures are anterior horn of medial meniscus, anterior cruciate ligament, anterior horn of lateral meniscus, posterior horn of lateral meniscus, posterior horn of medial meniscus, posterior cruciate ligament. This is tibial tuberosity. It has upper smooth part and lower rough part. The upper smooth part provides attachment to ligamentum patelli. The lower rough part is related to the subcutaneous infrapatellar bursa. Upper triangular area above tibial tuberosity is related to deep infrapatellar bursa. In the shaft, the anterior border is called the shin of tibia. The medial border in its upper 1/3 and lower 2/3 joins with the soleal line. And the lateral border is sharp and it gives attachment to the interosseous membrane. In the medial surface, in its upper part, here are insertion of three muscles which gives insertion like hockey stick. From before backwards, the muscles are sartorius, gracilis, and semitendinosus. In the lateral surface, in its upper 2/3, it gives origin to tibialis anterior muscle. In the lower 1/4, it is related to the side it gives origin to tibialis posterior muscle. In the lower 1/3, it is related to the following structures from medial to lateral. The structures are tibialis posterior, flexor digitorum longus, posterior tibial artery, posterior tibial nerve, and flexor hallucis longus. This is lower end. It has medial malleolus. The lower end has 5 surface: anterior surface, posterior surface, medial surface, lateral surface, and inferior surface. The anterior surface has upper smooth part and lower grooved part. The medial surface continues with the medial surface of medial malleolus. The inferior surface articulates with the body of talus. The lateral surface, there are the anterior and posterior tibiofibular ligament, and in its upper part there is interosseous tibiofibular ligament. In the posterior surface there is a groove for the tendon of tibialis posterior muscle. Then medial malleolus, in its tip it